Medicare supplement insurance plans are standardized, with most states offering 10 Medigap plans labeled with a letter. A Medigap Plan G provides the same coverage whether you purchase it in Florida or in Iowa. A Plan N with Mutual of Omaha is the same as a Plan N with Cigna. However, Medigap policies are standardized differently in Massachusetts, Minnesota, and Wisconsin. Hi, I'm Rick Teska with Senior Market Solutions, your Medigap insurance advisor. You may recall hearing this information in some of our other Medigap focused videos. I encourage you to subscribe to the SMS YouTube channel so you don't miss out on any of our new content. In this video, I'm going to answer the question, how do Medicare supplement policies in Wisconsin work? I'll start by outlining Wisconsin basic plan benefits, then Wisconsin state mandated benefits, followed by Wisconsin optional riders. Finally, I'll explain how to find coverage in Wisconsin that's equivalent to the standardized Medigap plans F, G, and N. So let's get to it. Wisconsin Medigap insurance policies start with basic benefits included in the standardized Medigap plans available in most other states. These four basic benefits are Medicare Part A, inpatient hospital care coinsurance, Medicare Part B, medical cost coinsurance, blood, the first 3 pints of blood per year, and finally, Medicare Part A, hospice care coinsurance or copayment. The Wisconsin Basic Plan also includes these 6 benefits: Medicare Part A, skilled nursing facility coinsurance, inpatient mental health coverage, 175 days per lifetime on top of what Medicare covers, home health care, 40 visits on top of what Medicare covers, Medicare Part B coinsurance, outpatient mental health, and finally, other Wisconsin mandated benefits. Now let's dig into the last benefit of the Wisconsin Basic Plan. As if Wisconsin wasn't already marching to the beat of its own drum, the Badger State also requires insurance companies offer a mandatory set of benefits. These are called, quite imaginatively, state-mandated benefits. Wisconsin Medigap insurance policies must include 10 state-mandated benefits. Number 1. Skilled nursing facilities. Wisconsin Medigap policies must cover 30 days of skilled nursing care in a skilled nursing facility. No prior hospitalization may be required. Number 2, home health care. If you qualify, policies must cover up to 40 home health care visits per year in addition to those provided by Medicare. Number 3, kidney disease. Policies must cover inpatient and outpatient expenses for dialysis, transplantation, or donor-related services of kidney disease in an amount not less than $30,000 in any calendar year. Number 4, diabetes treatment. Policies must cover installation and use of an insulin infusion pump or other equipment or non-prescription supplies for the treatment of diabetes. Self-management services are also considered a covered expense. Number 5, chiropractic care. A Wisconsin Medigap insurance policy must cover basic manipulation of the spine. Even if Medicare doesn't cover the claim, this state-mandated benefit is available to Wisconsin beneficiaries. Number 6, hospital and ambulatory surgery center charges and anesthetics for dental care. Policies must cover hospital and ambulatory surgery center charges incurred and anesthetics provided in conjunction with dental care for an individual with a chronic disability. Number 7, breast reconstruction. Policies must cover breast reconstruction of the affected tissue incident to a mastectomy. Number 8, colorectal cancer screening. Policies must cover colorectal cancer examinations and laboratory tests even if they do not meet Medicare's guidelines. Number 9, coverage of certain healthcare costs in cancer clinical trials. Policies must cover certain services, items, or drugs administered in cancer clinical trials in certain situations. And finally, number 10, catastrophic prescription drugs. Wisconsin Medigap policies issued prior to January 2006 to Medicare beneficiaries not enrolled in Medicare Part D must cover at least 80% of the charges for outpatient prescription drugs after a drug deductible of no more than $6,250 per calendar year. To learn more, I encourage you to visit our website, seniormarketsolutions.com. In the description, there's a direct link to access our free Medicare and Medigap resource library. You'll find Medicare guides in our resource library, including the Wisconsin Guide to Health Insurance for People with Medicare, which has additional details. Now that we've reviewed the benefits covered by the Wisconsin Basic Plan, let's move to the optional riders available to Wisconsin beneficiaries. These 5 optional riders are meant to fill the coverage gaps. Number 1, Medicare Part A deductible. This is one of the most important riders because there's a high potential for this deductible to cost you thousands of dollars out of pocket. The Part A deductible rider pays the Medicare Part A deductible, which is $1,364 in 2019, and expected to be $1,420 in 2020. Number 2, Medicare Part B deductible. The Part B deductible rider pays the Part B deductible of $185 in 2019. The amount of this deductible can change from year to year. In 2020, it's expected to be $197. Number 3, Medicare Part B excess charges. A doctor may accept Medicare, but might not accept Medicare assignment. If a doctor doesn't accept Medicare assignment, he or she can charge you up to 15% more than what Medicare will approve. The Medicare Part B excess charges rider covers the 15% difference between the excess charges and what Medicare has approved as the full payment amount. Number 4, additional home health care. This rider extends the Wisconsin Basic Plan coverage from 40 to 365 home health care visits per year. Number 5, foreign travel emergency. This rider provides up to $50,000 lifetime of coverage for medical expenses incurred outside the United States, including travel aboard cruise ships that sail beyond U.S. boundary waters. There's a $250 deductible, but this rider is a necessity for international travelers. The last 2 optional riders are designed to reduce premiums rather than fill in coverage gaps like the previous 5 riders. Not every insurance company offers these 2 optional riders. Number 6, Medicare 50% Part A deductible. This rider provides coverage for 50% of the Medicare Part A hospital deductible per benefit period. The beneficiary is required to pay the other 50%. Number 7, Medicare Part B copayment coinsurance. This rider, you must pay the Medicare Part B deductible. After meeting the deductible, your policy will cover Part B services after Medicare. However, you'll also pay a copayment of up to $20 per doctor's office visit and a copayment of up to $50 per emergency room visit. So we've reviewed the Wisconsin Basic Plan, which includes state-mandated benefits. We've also talked about the optional riders for Wisconsin Medigap insurance policies. Now let's circle back to answer the question. As a Wisconsin beneficiary, how can I find coverage that's equivalent to a standardized Medigap plan? Of the standardized plans available in most states, Medigap plans F, G, and N are the 3 most popular options. Most folks we talk to are interested in one of these 3, so that's where we'll focus. To find coverage in Wisconsin that's equivalent to the standardized Medigap Plan F, start with the Wisconsin Basic Plan and add these optional riders. Number 1, Number 2, number 3, number 4, and number 5. By adding these riders, you'd pay $0 out of pocket. To get the Wisconsin coverage that's equivalent to the standardized Medigap Plan G, start with the Wisconsin Basic Plan and add these optional riders: number 1, number 3, number 4, and number 5. By adding these riders, you'd pay the Part B deductible of $185 in 2019. In 2020, it's expected to be $197. To find Wisconsin coverage that's equivalent to the standardized Medigap Plan N, start with the basic Wisconsin plan. Add these optional riders: number 1, number 4, number 5, and number 7. By adding these riders, you'd pay the Part B deductible of $185 in 2019. In 2020, it's expected to be $197. You'd also pay a copayment of $20 per doctor office visit and a $50 copayment for emergency room visits. Now, if you're feeling overwhelmed, don't worry. You're not alone. At Senior Market Solutions, our specialty is Medicare supplements. As fellow Wisconsinites, we know the ins and outs of the Wisconsin Medigap market. For Wisconsin beneficiaries, especially those who are new to Medicare, SMS is your perfect partner. At SMS, we work with all of the top companies such as Aetna, Cigna, and Mutual of Omaha, so our customers get the best rates available. Book a free Medigap consultation by calling us toll-free at 1-855-784-9649 or click the link in the description to book your appointment online.